Patients who come to our centre for treatment from outside the UK will need a little bit more attention and planning. We will try and do as much as we can virtually. So the first consultation will be virtual. We will review the notes carefully before the first visit. But at some point, I will need to see the patient before we confirm the plan for surgery. Sometimes we can confirm the plan for surgery if somebody that I know and trust has seen and examined the patient, and then we'll just have a brief meeting before surgery. Apart from that, it's also important to minimize the number of times a person needs to travel to the UK, particularly if you're living far from the UK, in the States, for example, or in Canada. We will try and put all of the things that need your presence in one meeting. So, for example, if you need an MRI and you also need to see me to be examined, we'll try and coordinate that in a way that we can do both at the same time. And sometimes it's possible to plan that for shortly before surgery, and that means that you travel, you get examined, everything is in place, there is a provisional plan for your surgery, and then I see you a couple of days before surgery with the understanding that that examination may change things, even the surgery may get cancelled. This hasn't happened yet, but it's a possibility that you need to consider if you're traveling to the UK for your treatment. And for after your surgery, our advice usually is to stay around in London for a couple of weeks, sometimes slightly longer if your surgery is particularly complex, to make sure that everything is fine and there is not going to be any issues when you go back to your country. Our team is very experienced in looking after international patients, and we have a team that can help you in navigating the route through to finally getting your surgery done.